Hello and welcome to this episode of Ignite Health with Caribbean Surgery. I am Dr. Surendra Persaud, the Medical Director of Caribbean Surgery. Joining me today is Dr. Allea Phoenix, one of the general physicians we have at Caribbean Surgery. Dr. Phoenix, thank you very much for joining us and welcome.
Thank you, Dr. Persaud. It's my pleasure to be here today to share any insights that I have on the topic of breast cancer.
So as Dr. Phoenix has just prompted us, the month of October is nationally and globally recognized as Breast Cancer Awareness. And so Dr. Phoenix and I will be having a conversation today as we discuss the various aspects on how we encourage the general public to be aware about breast cancer. How do we raise that awareness? What are the screening programs? What is involved in a breast self-exam? What are some of the unfortunate myths that surround this? And in the final segment, we will summarize that. So Dr. Phoenix, let's start with what is breast cancer awareness and why is it necessary to screen?
Thank you for that question, Dr. Persaud. Well, breast cancer awareness is just more, as it says, bringing the attention of breast cancer to the general public. And while we do this, we often talk about when we actually do the screening. And screening is often recommended for women of reproductive age and also women of in the postmenopausal period. And these are women between the ages of 15 to 45 in the reproductive age versus the postmenopausal being those that are older than 45. Generally, in Guyana, it's recommended that persons complete what is called a screening mammogram, and this is done for patients between the ages of 40 and over. But it's important that we know that breast cancer screening is not only limited to a person based on imaging, but also the self-examination and clinical physical examination plays a key role in this.
Now, one of the things that might confuse the patients when they read this, if you go online, you will find that different countries may have different recommendations, and that could obviously lead to some confusion. I'd like you to repeat for the purposes of the various aspects. So let's speak about when does a woman start doing a breast self-exam? Then the next question is, in Guyana, what is the recommended age at which we start a mammogram and when we stop a mammogram? And then we'll come back to the frequency. So when should a woman start her own breast self-exams?
Right. So thank you for that question. In regards to actually starting the breast self-exam, as I mentioned, generally it's recommended that women of reproductive age, so even a teenager at 15 years, they can do their self-examination on their own. And ideally, it's recommended that when they're doing their exams, it's done about 3 to 5 days after they complete their menstrual period, because this is shown to have the best period. What about in a scenario where self-examination is going to be done on an older woman or a postmenopausal woman? They can still do their breast examination. However, there's no specific timeline in regards to their menstrual cycle. However, it will be in a situation where they choose a specific day. If they want to choose the first day of every month, that day they're better able to keep track of what are their findings, and they'll remember to actually do it every month. Right. Now, addressing the second question, which speaks to actually completing the mammogram, here in Guyana, the Ministry of Health generally recommends that mammograms are completed for women ages 40 and older, and these are done for persons with moderate risk factors. What would be moderate risk factors? It could be a woman that had a previous history of some other type of cancer, if they have any type of family history, if they have any specific type of gene mutation, if they had their period starting very early, if they were younger than 12, if they've never had a pregnancy, never had a child before. These women are referred to as nulliparous. Generally, it's recommended that a mammogram, a screening mammogram more so, can be conducted. But of course, imaging more so for breast cancer and then screening as a whole is not necessarily only limited to the mammogram. In some cases, some younger women do have risk factors, and so the imaging would still play a role. And in these cases, we would do an ultrasound instead of the mammogram for these women.
So one of the key things we need our patients to understand is the difference when you're coming in for something that is considered a screening test versus when you have a concern and you're coming in. So screening implies that we are doing something to a general population, and we are subjecting everybody to this test with the hopes of finding a disease or a process earlier and be able to intervene into it. So as Dr. Phoenix has said, for mammograms, We're talking about the general public, and we're suggesting in Guyana starting at the age of 40. How often should they get their mammogram?
Well, that is a question that is very challenging in some cases. Some persons would say annually, some persons might say every 2 years. It's very dependent. Here in Guyana, we generally work with the narrative of annually or every 2 years. But of course, this would be dependent on that individual patients, their risk factors, if they ever had any type of concerns in the past when it comes to the breast, not just limited to breast cancer only. But that is the general timeline that we would recommend.
Now, when we get into, as Dr. Phoenix mentioned, ultrasound, so why is it 40? What happens to the woman between the age of onset of reproductive ability and 40? And what happens, a mammogram is an X-ray. And younger women tend to have breasts that are extremely dense. And so if you did an X-ray, a mammogram on that breast, you will not be able to, it will be white. It'll be like a sheet of paper. And so for those sections of the population, we recommend ultrasound. Now, in terms, as Dr. Phoenix mentioned, there has been a lot of debate over whether it should be annually, every 2 years, and as people read, they will get very confused, and we recommend you have a conversation with your physician to assist you in making that decision. There's also an ongoing debate about when this should stop. So in the postmenopausal women, there have been different recommendations. So we will pause at this point, and in the next segment, we will go on to a discussion in greater detail on how the breast self-exam is done. Thank you very much.
Have you heard? The Ministry of Health has launched its cervical cancer screening voucher program for women aged 21 to 65. Eligible women can pick up their vouchers at any distribution site in their regions. Each voucher, valued at $8,000, can be used at any of the health facilities listed on the back of the voucher. Cervical cancer caused by persistent HPV infection is the second leading cause of cancer-related deaths among women in Guyana. Early screening is crucial to detect and treat precancerous cells. Early detection saves lives. Ladies, don't hesitate to get screened for cervical cancer today. Your health matters. For more information about this program, call 227-4357 or visit the Ministry of Health's Facebook page.
Dr. Phoenix, welcome again. So let's now discuss the breast self-exam. Describe sort of when this starts and how this is conducted by us when a patient, predominantly a woman, comes to the clinic.
Right. So in terms of the self-examination, as I mentioned before, usually about 3 to 5 days after your menstrual cycle, if you're in that reproductive period of your life, or postmenopausal, generally you just choose a day, if it's going to be the first day of every month, and this can be done in the shower or in front of your mirror. If you have a mirror in your shower, anything is fine. And in every given exam, it's important that the patient or whoever the person is, they look, touch, and they squeeze, right? In that same order. First, we would inspect the breast, and this is to look at the skin on both sides and even in the armpit region, just to see if there is any type of changes. Does the skin look darker than usual? Is there any dimpling? Is there any scarring? Is there anything new that you're not accustomed to? What about the shape and symmetry? Is the shape what you're typically seeing normally for yourself, or is there a change in your size? Is one size significantly larger than the other? All of these things that are things that we will look at when we're inspecting. And this is more so when the person is standing in front of the mirror, hands to the sides, and then once that's finished, you can repeat the same process with your hands on their hips. And when they do this, they have a good scope of what they'll be looking for.
Sorry, go ahead.
Sorry.
Go ahead.
Once that is complete, the person would move on to actually palpating along the breast, and they can decide if they're going to move in a circular fashion or if they will move from top to bottom. The important thing is that they're uniform and they catch all areas of the breast. The initial process of the examination, and that includes the inspection aspect. And first, that's just basically involving looking at the patient, looking at the symmetry of the breast. You also confirm with the patient if this is their normal presentation. Is this normally how the breast is for them? And once you confirm, you would move on to closer inspection. Once you're doing closer inspection, you could check around the neck, around the armpit. You can even ask the patient to raise their arms. Can you raise your arms up above your head, all the way up? And that gives us good visualization of both axillas. She can put that down. And then after that is complete, you could just do general assessment of the breast tissue. And you're looking for if there's any type of scarring, any type of discomfort or so. Once that is finished, we'll move on to check in the lymph nodes. And we would start with the lymph nodes in the head and neck. Of course, persons may not see the relevance, but knowing breast pathologies, it's important to check. So we check all lymph nodes in this region. Once that is complete, we can also palpate in this region, and we move in a circular fashion from in to out, applying light to medium pressure first and then firm pressure. So we can apply light pressure here. And then we check here, and then we move on to the next side and do the same thing. And it's important you notice I'm using the ball of my fingers and not my fingertips. So once I'm satisfied with this, I can have the patient lie on the bed. Flat on the bed, we can first inspect again in this scenario because the breast is being seen in a different plane, looking for those same things that I mentioned initially. Now I'll have the patient raise her hands above her head, and this is just so that we can have a better overview. And we start our palpation, and we'll start medially, meaning more closer to the body, and then we work our way outer. Now I apply firm pressure in the midline, and I also ensure that I check in the axillary region here, ensuring that there are no lumps or bumps. Once that is complete, I repeat the same process on the other side of the patient. So she puts her hands above her head, and we start from the outermost quadrant, and we work our way in. And I apply light pressure once again with the ball of my fingers. Right? Once that is complete, I go more to the midline, feeling for lumps, bumps, or nodules. And then lastly, I check in the axillary region. Good. Once that process is complete, I would usually ask the patient to express their nipple, basically by squeezing. And there we will check to see if there are any types of discharges, whether it be bloody or pus-like or otherwise. If we do find these findings, then definitely further tests will need to be done. But generally, this is the process that we would follow for our breast exam. And if any significant finding is found, then we would upscale therapy, whether it's to do some type of imaging or special study. But that's the entire process that involves a breast examination.
So one of the key reasons we help patients by doing the breast exam, although literature has questioned the value of it, we still believe it is important for a woman to do her own self-breast exams. We as physicians may see a woman once every 6 months, but what we're doing is we're encouraging the woman to do her self-breast exams monthly. And so the key here is, and the key reason we do this is as the woman examines her breast, she will learn what is normal or usual for her breast, and then if something changes, she will pick it up earlier, and that will then drive her coming into the office. What are some of the other technologies? You know, ultrasound, for example, has now been seen as an extension of the physician's hand. So explain how we would use an ultrasound in, again, this younger population, the women who are before 40. How do we use the ultrasound as an extension of our examining arm in breast exams?
Okay, thank you for that question. In regards to the using of ultrasonography, well, the technique as a whole basically utilizes some ways to basically see the overall anatomy of the breast. It's very useful because, as Dr. Persaud mentioned, younger women generally have denser breast tissue. And by using the ultrasound, it gives us a better visualization as opposed to the mammogram with the different areas of the breast. Oftentimes when you hear persons describing the breast or doctors describing the breast, they use the clock. You might notice if you ever had a breast exam for yourself that, oh, there's a swelling at the 2 o'clock position or at the 1 o'clock position. And it's just better able to give us an overall visualization of all the quadrants of the breast and more accurate readings tailored to the younger population.
Now, the vast majority of the time when we do a breast self-exam, whether it's done as a clinical examination by one of us or the patients, the vast majority of the time, thankfully, we don't find anything unusual. But Dr. Phoenix, walk us through the various modalities, the various options, or what else we will suggest the patient have. What are some of the unusual findings and what do we suggest thereafter?
Thank you for that. So let's just start by saying if there is a scenario where we find something that's concerning, it's not always breast cancer. There are conditions that may be benign, meaning non-cancerous, or malignant, which has the cancerous definition attached to it. So in some cases, some persons may have a cyst or just fibrous changes, which is one of the most common changes that a woman who does have a lump in her breast, if she's younger, this is the typical finding that we would have. However, if there is a case where we do have concerns that this may be leaning to something that's more malignant or cancerous, then in that case we would opt for that patient to complete something called biopsy. Usually the gold standard type of biopsy for the breast is a core biopsy, but of course there are different types of modalities that are available, which includes the excisional biopsy or FNAC, which is a fine needle aspiration cytology. But this is all dependent on the patient and what their clinical findings are. But based on current standards, if it is that we do find something significant from the imaging, then we would opt to complete a biopsy. And this would complete something that we have in the clinical practice known as the triple assessment screen, where we do a thorough history and physical examination for the patient. We do a specific imaging modality, whether that be mammography or ultrasonography, and then lastly biopsy, if we do find something concerning from those previous assessments that were completed.
Now, one of the things we find that's very, very stressful for most patients is they come in with either an ultrasound report or a mammogram report, and sadly we have bolded many things, and this causes a significant amount of confusion into the patients. And so you will see classifications like BIRADS, and you will see other classifications. What we are asking all of our patients to do is take that report, go to your doctor, have a conversation. Of course, many of us are going to go on the internet and research that, and then that adds to the anxiety. So bring that in. So we are going to now move on to discussing some of the regrettable but common myths that we have to deal with our patients. So Dr. Phoenix, what would you say are some of the more common misconceptions that patients have as it relates to a breast?
Well, one of the biggest ones, I think, is in the Guyanese population and the world at large when we're having a conversation of breast cancer is that if I don't have a family history of breast cancer, then that's not something that's going to happen to me. Unfortunately, in the world, approximately 85% of all cancers that are diagnosed is in a person that has zero family history. That's why it's very important that we all take screening into account and make it our business to find out what specifically is going on with our health.
Right. So what about breast cancer in men?
This is a very good one as well. A man would usually think that because they're a man, they're immune to breast cancer. This is not true. For 1 in 100 breast cancer case that is diagnosed, one is a man. It's very rare, but it doesn't mean that you shouldn't have this narrative or you shouldn't think about screening for yourself. That's why it's very important as a man, you should generally pay attention to your breast tissue as well and look for changes that you're not typically seeing. Right.
So one of the key things we say to men, whilst in women, a lump in a woman is the large percentage of them are going to be benign. There's no such thing as a normal lump in a man's breast. And the other thing of concern, men, we generally have a lot less breast tissue. So since breast cancer spreads many times directly, and we stage breast cancer based upon a number of factors, in men, when there is a breast cancer, it's actually usually at a later stage. What about the concern about mammograms and the fact that it's a radiation? And how do we then assure our patients that this level of radiation is acceptable?
That's a very good question as well. Well, mammograms do expose us to some amount of radiation, but it's very small amount. Oftentimes, persons would say you could equate it to having a very short flight, and of course, we're still going to go on our vacation. So what's to say we shouldn't take care of our screening health in this regard? So it's just a very small price to pay, and the benefits generally would outweigh the risk. when we're talking about screening using the mammogram.
Now, I'd like to have a final conversation here in this segment about fibrocystic changes and also a breast lump. So a person gets an ultrasound or they get a mammogram, and boldly written it says fibrocystic changes, or it says you have a breast lump. What are the things that we do next?
Well, in those cases, it's dependent on the patient's level of comfort with this, because most times when you see fibrocystic changes or fibroadenoma, this is usually a benign finding, and there are options that are available in terms of treatment. There's an option to just leave it alone, or there's an option to actually excise it. It all depends on the patient's level of comfort with that, but of course this is a benign finding, and most times when it is excised, it's because the person isn't really comfortable. And since we're on that note, I think it's very important for me to point out a very common myth that all lumps are not cancer. A lot of persons might think that if they have a breast nodule, a lump, or any mass present in their breast, that it's cancer. This is not true. It could be a case where it's just simply fibrocystic changes, which is basically one of the building blocks that may be seen in the breast.
And one of the key things we say to our patients with a breast lump, it's the final diagnosis is based upon a tissue evaluation. So whether that's a fine needle, a core biopsy, but you need the pathologist to either look at a piece of tissue, and they are essentially the final decision maker on exactly what that is. It doesn't necessarily matter what we think it is on a physical exam, what the ultrasound says, what the mammogram says. The final decision and how we can assure our patients of what that lump is, if it's a solid lump, is based upon an actual piece of tissue. Now, in this final segment of this today's episode, we will be summarizing what we are talking about. So what does the patient do? So let's walk through, Dr. Phoenix, with the different age groups. Let's talk about the younger woman who has not attained the age of 40. We said we would do mammograms. So if you have started your menstruation, but you're under 40, what should you as an individual be doing, and how often should you interface with the medical community?
Thank you for that question. So as we previously mentioned, in this population, we would recommend that they complete the breast self-examination. If they do find something that is significant, then we recommend that they follow up with their personal physician or healthcare provider. When they do follow up with their physician, if the findings are consistent, then we would recommend imaging for this person, specifically with an ultrasound. And based on the ultrasound findings, if the person does or if they do have any type of finding, then we would follow up with a biopsy just to confirm the results and ultimately create an appropriate plan for that patient.
Right. So a breast lump on ultrasound can either be a solid lump or it can be a cystic lump. And the ultrasound is actually exceptionally good at distinguishing the two. In most lumps which are cystic, we will place a needle into that liquid and aspirate it and send that for evaluation. Solid lumps, we are going to recommend a tissue biopsy. Now let's get into that segment of the population that is now, as we've said, in Guyana, we recommend 40 plus. We're not going to discuss the end date because that is a sort of a personalized conversation between the patient and their doctor. But let's talk about the woman now is 40 years old. Describe, because many persons are uncomfortable getting a mammogram. So describe what exactly is a mammogram, how many images are usually taken, and the frequency that we currently recommend for that.
Okay, thank you for that. So in a patient that is older than 40 years, generally we would recommend the same first two steps, which is just getting a thorough history and physical examination on that patient. And the screening would generally be performed for that patient maybe annually or every 2 years to conduct that procedure. And in the mammogram, it basically is an X-ray, as Dr. Persaud previously mentioned. The breast tissue is placed between two plates, and it takes a comprehensive view of the breast in different positions, and it's done on both sides to make sure that all aspects of the breast is assessed. And based on those findings, then we would know if any additional tests or any additional studies may be performed for that person. But it's done in all planes to assess the general appearance of the breast.
So coming back to this entire topic of breast cancer awareness, you will see in the adverts that are running in the background what Caribbean Surgery is doing to assist the public in getting this screening done. And why are we screening? We're screening because, as this slogan says, early detection saves lives. And what does that mean? Breast cancer, like all cancers, are staged. Stage 1, stage 2, stage 3, stage 4. And it has to do with a number of parameters. But what we do know today is if a woman walks through the door with a stage 1 cancer, we have a much higher chance of that woman being alive 5 years today with the treatments we have. So we need these patients to do these self-exams, to be participating in the screening so you come on in. Another teaching, repeat what you said about men and the need for them not to ignore lumps in their breast.
Definitely. So in any case, if a man looks at himself, looks at his chest region, and he sees that maybe the appearance is not right, or you feel a lump, definitely in your case, we would recommend that you come in to any specific clinic, see your doctor, and there we may recommend to complete the same imaging study. We probably wouldn't do a mammogram more, so we might do an ultrasound or any other imaging study if we have concerns about other things, because of course this is not very common in men, but it's something that should not be ignored. So the first step would be following up with your doctor if you do find anything of concern when you're doing your own personal checks.
Now, many persons will ask about lifestyle, eating healthy, living a healthy lifestyle, and the answer to that is simply yes. So it is important in all of what we call the non-communicable chronic diseases to engage in an active and healthy lifestyle and to eat the best you can. Dr. Phoenix, give us one summary paragraph on what you want our audience to walk away with and what do you want them to do next?
Well, to summarize all that we've talked about, I think it's important that everyone makes breast cancer and just awareness at large their business. Everyone should ensure that they do their self-checks at home or engage your family members, your communities. For those that already had that experience, it's important that you also remain vigilant. Self-awareness is key when we're talking about breast cancer. It's very important, yes, to have a healthy lifestyle. Generally, it's recommended, I tell this to all my patients, that you complete 150 minutes weekly of exercise, and that translates about 30 minutes a day. Ensure you use a balanced diet, not just limiting yourself to carbs only, but also your healthy fruits and vegetables and healthy proteins as well, so that it wouldn't take away the risk ultimately, but it puts you in a better position. And I hope that all of you leave this program with the message that breast cancer is your business as well, and you should work to spread awareness as well and be the change that you hope to see in society.
So my final words on this is, remember, breast cancer, if there are 8 women sitting in a room, one of those women has a lifetime risk of developing breast cancer. We screen for diseases because if we find it earlier, we can certainly improve the outcome. And that's why there's breast cancer screening, which is the breast self-exam, ultrasounds, mammography, etc. And again, men, please be cautious of this. And so please look at the social media profiles of Caribbean Surgery. You will see what we as an entity are doing to help you get this screening done. And so on that note, we thank you very, very much, and we look forward to you joining us on the next episode.